Thank you for joining me here at the live desk. I am Janae Hancock. It is Thursday, November 30th, so we are right at the end of the month, almost there and almost a Friday as well. Today we are going to be talking about one of the major headlines this morning, and the Board of Johnson County Commissioners, they just wrapped up their board meeting, and on the topic today, on the agenda, was the topic of mental health, actually adding more positions. So with that being said, I do want to bring in Director, Community Mental Health Center, Tim DeWeese, and let's just go straight into the main topic today. What was the outcome of the meeting? I know you all were in there all morning long, and it is a major discussion, but what was the outcome?
So the outcome was a 7-0 unanimous vote to support and approve the adding of the 13 positions that we were asking for. So it was a positive outcome after a lot of good, robust discussion.
13 more positions. Let's break that down just a little bit more. What are those main positions, and why do you feel like you all need that going into the new year?
Yeah, so one of the things that has happened here in Kansas is that the legislature 2 years ago passed a bill that I think pretty much went unnoticed, but it really revolutionized the way that community mental health centers were funded. And it created a cost-based system, meaning that we would get full cost for providing services. And so today we're able not only to recoup our full cost of providing those services to the community, but we're also, after 10 to 20 years of not growing, able to grow and serve more people. And so these 13 positions specifically, a lot of them are around nursing, because we need to continue to provide medication services. And we'd also like to also address people's healthcare issues. So, if we help someone with a mental health issue, but they have diabetes, or if they have high blood pressure, we would be able to evaluate that, provide them support for that, maybe even get them connected to treatment for those services. And that way, we're just approaching it from a whole healthcare model. And then we also received some funding from the state around Kansas Fights Addiction. So that really has to do with the opioid epidemic. And so we're adding 2 staff of that 13 to really provide prevention efforts, as well as a communication specialist to just make the community more aware of how important this issue is, and how many people are actually dying due to fentanyl overdoses.
And I know that there was someone within the meeting today that discussed that they don't think that this is good for taxpayer funds. What do you say to that? What is your argument on that?
Well, my argument is I don't disagree. That's why I was asking for approval to spend funds that we brought in from the state, which are a combination of state dollars and federal dollars associated with Medicaid. So we weren't asking the Johnson County taxpayers for any increase. We are actually funding this all within the Johnson County mental health budget through state dollars, as well as federal dollars that are drawn down through Medicaid. So it really is an opportunity for us not to rely on the taxpayers regarding property taxes and things like that.
And I know you all made decisions based off of data, so there's obviously a great need in Johnson County, but are we seeing that great need more in younger individuals than we are older?
Yeah, I think that what we're seeing overall, there's a greater need. I do think that there is an acceptance for younger people to seek treatment. And so when we say younger, I mean what we would refer to as young adults, people that are maybe coming out of college, people that are in high school, and even young people that are transitioned from elementary to middle school. So those are some of the hardest transitions. And so we're seeing more and more people reach out for those type of supports. And I think that's something that we need to continue to promote. It's really about destigmatizing mental health issues and mental health conditions, so that people treat them no differently than diabetes or hypertension or any other healthcare issue.
And I know that this is a hot topic across the country, but especially in our state as well. What are the next steps now that you all have been granted these 13 positions? What happens next?
Well, the next step is for us to get them posted and then try to recruit, because what we know is that there is a shortage of healthcare professionals across the nation. So I got asked that question, and I think it will be difficult. But I think one of the things that bodes well for Johnson County and for Johnson County Mental Health Center is that we are well supported by our community. I mean, a 7-0 vote to allow us to utilize $1.1 million to add 13 positions. That demonstrates support from our elected officials. It demonstrates support from our community, and people want to go where they can make a difference. And so that's hopefully one selling point that we can make for individuals that apply for these positions. So it's really about being able to get those positions filled and start off the new year with providing some increased access to care.
7-0 vote. I definitely want to go back to that. As a center, you all have to be feeling very eager, very excited going into the new year, knowing you have these new positions. Is that correct?
Absolutely. And this is the second major vote that the BOCC has taken. Earlier, I think it was in September, they voted to pass an initial 24 budget, which actually added 15 positions. So, you add these 13, and we're talking about 28 new positions as of January 1st, 2024. So we are in a really good position. And like I said, we feel very happy it's really nice to know that your community sees the importance of mental health and they support it by helping us move this forward.
Awesome. Tim, before I let you go today, are there any final thoughts that you would like to add to this interview? Anything else you would like our viewers to know?
I think the main thing is that as we approach the holidays, sometimes for us, it's not always, we can't have that holiday spirit 100% of the time. Maybe I'm experiencing a little bit of that after a 7-0 vote. But the bottom line is that we all need help from now and then. And so if you're experiencing any type of mental health issue, you can always call 988, whether you're in Missouri or Kansas, or frankly, anywhere in the nation, and receive and connect with a mental health professional. So don't be afraid. You're not alone, and reach out for help when you need it.
Perfect. Tim, thank you so much for joining me here at the live desk on this Thursday to discuss such an important and timely topic. So I appreciate your time today.
Thank you, Janae, and I appreciate you bringing light to this subject.
Of course. Like I said, it is a hot topic not only in our state, but across the country. Our coverage will continue here at KCTV5. Be sure to tune in to our 3:30 newscast. Our noon newscast is going on right now, but we have our 3:30 newscast to look ahead to.